Good afternoon, everyone, and welcome to our webinar with the Improvement Service and Public Health Scotland and Moray Council as well today. Today we're looking at place and wellbeing, and I'm joined today by Susan Rintle, who's the Project Officer of the Improvement Service in the Planning for Place and Shaping Places for Wellbeing programme, and Emma Doyle, who's the organisational lead for housing and homelessness. And prior to this, Emma worked with Susan at the Place team in Public Health Scotland. Also with us today are Margaret Douglas, who's the co-director for the Edinburgh University Masters of Public Health programme. She's also an honorary consultant in public health at Public Health Scotland and the chair of the Scottish Health and Inequalities Impact Assessment Network. And finally, Gary Templeton, who's a Strategic Planning and Development Manager at Moray Council. The format for today's session will be, we will be going through the recently published document, Place and Wellbeing, published by the Improvement Service and Public Health Scotland, then passing over to Margaret, who will be looking at the public health side, then to Gary, who will be looking at how it's been integrated into planning.
Great. So as Trevor said, the purpose of the webinar is to highlight this recently published briefing. The briefing was developed by the Spatial Planning, Health and Wellbeing Collaborative, which is a group that has representation from the Directors of Public Health Scotland, the Improvement Service, COSLA, Heads of Planning Scotland, Health Improvement Managers Network, and Edinburgh University. And the group was brought together to look at how we can work more collaboratively on this agenda of public health and planning. The briefing's aimed primarily at land use planners and public health professionals, but it will be relevant to others working in the areas of the built and natural environment and health and wellbeing and community planning. And it might help anyone really with an interest in these areas to understand the context we're working in and how to deliver wider public benefits from the work. And the purpose of the briefing was really to create a starting point. And it really is a starting point because when we started on this work, trying to work more collaboratively together, one of the first things that we discovered was that a lot of people in public health don't understand in any great detail how the planning system works, myself included, and sometimes don't understand when development is detrimental to health, why, for example, planners can't just refuse planning permission for things. And so understanding the way the planning system works is really helpful. And lots of planners don't necessarily fully understand how the NHS is structured in Scotland and how public health fits within the NHS structures, and why going for health advice to one part of the NHS might produce different evidence and information than going to a different part. And this kind of lack of understanding of each other, using different languages and working in sort of different systems, was a barrier to collaboration. And so that was why we felt like a briefing like this would maybe help us to understand each other better and to see where the opportunities for collaboration are. And we do have a lot of shared ambitions and a policy context that increasingly encourages us to work together. So planning for health and wellbeing is obviously not a new activity, and there are already examples of good practice from right across Scotland. We'll hear about some of them today. But there are several kind of developments, either recent or forthcoming, that provide an even stronger context for this working. So the Public Health Priorities, Planning Act 2019, and the forthcoming National Planning Framework, as well as the impact of the pandemic, which has changed in many ways our relationship with place and made it even more obvious how place and health and well-being are connected. So all of these mean that planners in public health now have an even clearer obligation to work together. And in addition, the place principle, which was adopted in 2019 by COSLA and the Scottish Government, encourages a more joined up approach and closer working to improve the lives of communities in Scotland. So some of examples of this: the Planning Act introduces the requirement for health effects assessment of sorry, my screen just blipped there. So the Planning Act introduces the requirement for health effects assessment of both major and national developments. This is potentially really helpful development, but obviously we'll expect guidance and regulations on how this will work in practice. But we can start to think right now about how it might work, and Public Health Scotland is certainly thinking about this and would welcome discussion if others are thinking about it too. And similarly, the forthcoming National Planning Framework 4 has several high-level outcomes, and one of them is to improve the health and well-being of people living in Scotland. Again, this creates context in which there's a real imperative for planning to think about how it impacts on health. And Scotland's public health priorities, of which there were 6. The first one of these is a Scotland where we live in vibrant, healthy and safe places and communities. And it's important to note that these public health priorities are not just the priorities for Public Health Scotland or for public health teams, but they are genuinely the priorities for all of Scotland. They were developed in quite a collaborative way with a broad range of professionals and with communities. And so these have been signed up to right across the board, including local authorities. So they really are the priorities for all of us. And that one with places and communities being right at the top, again, provides a really supportive context to this work. So why it's so important is that Scotland continues to face significant health and wellbeing challenges, an ageing population, which will impact on how we use housing and public places in the future, enduring health inequalities, deprivation and poverty, which, as you'll know, have often got a spatial expression, so areas of great poverty and deprivation across the country. Changes in the pattern of disease and increasing pressures on health services going forward. Average life expectancy in Scotland is still lower than in other countries in the UK and the rest of Western Europe. And our health and well-being is shaped by many different factors: individual, cultural, community, environmental and global factors, some of which we can easily control and some of which less so, but certainly how we plan and design the built environment can have a significant impact. And if you think yourself about the places where you live, work, play, spend your time, and how these places make you feel, and how that impacts on your own health and well-being, you kind of recognize the important influence that places and spaces have on our health and well-being right throughout our lifetime. So if you live in places that have clean air and access to green space, access to services and amenities, access to employment, schools, things like that, it's obviously supportive of your health and well-being. But living in areas with poor air quality, noise, pollution, vacant and derelict land and things like that are more likely to be quite detrimental to your health and your well-being. And those living in areas of greater deprivation are more likely to be exposed to harmful environmental factors and less likely to have access to beneficial ones. So there's a real inequalities issue there, and these inequalities in the physical environment reinforce health inequalities. And as many of you will be aware, this has been exacerbated by the effects of the COVID-19 pandemic, when people's access to green space, for example, had a real impact on how they were affected by lockdowns. Okay, so we have begun to map out some of the ways in which planning interventions can lead to better health outcomes, to sort of try and demonstrate that for people. So for example, interventions such as safe segregated walking and cycling paths, natural space and multifunctional green space, integrated health centres, leisure spaces, shops, community and education space, space for uses such as play, events, markets, and embedding communities into the management of the places in which they live will lead to increased physical activity, more interaction with nature, better use of local amenities, more social engagement, better community cohesion, and hopefully less car use and ownership and lower travel costs. And the impact of this is to improve mental health and to reduce obesity and respiratory disease, heart disease, diabetes, stroke, cancers, mortality and morbidity, and it also benefits the planet through reductions in emissions and increased biodiversity. So that's just one of the ways in which we've kind of begun to sort of map out the real impact on planning on health. And I'm going to hand over to Susan now, who's going to talk a little bit more about what's in the briefing.
That's great. So next slide, Emma. So the briefing aims to raise awareness of the impact that places where people live, work and play have on their health and well-being. And it also aims to introduce land use planners to the public health system and public health to the planning system, and also set out where key legislation and policy requirements overlap. It also goes on to highlight opportunities at key stages where more integrated working between land use planners and public health professionals can help to deliver greater quality in health, wellbeing and sustainable outcomes. The next slide, thanks. So the briefing also introduces the place and wellbeing outcomes, and these have also been developed by the Spatial Planning Health and Wellbeing Collaborative. And you can see here the outcomes fall under 5 overarching themes. So they are movement, spaces, resources, civic and stewardship. So the place and wellbeing outcomes aim to support local government and their partners in how they make decisions about our places that ensure policies are designed to support climate targets, improve the health of our communities while also reducing inequalities, so creating that triple win. So by embedding the outcomes in planning and public health, we can provide that more joined up approach, whereas at the moment current legislation landscape is frequently siloed and the outcomes aim to create one joined up approach to place. So if we go to the next slide, Emma, we've now finalised the wording of these outcomes and you'll be able to find them in the appendix of the briefing paper, but also on our Planning for a Place web pages. The outcomes have been piloted in 3 rapid scoping assessments, which I think Margaret will touch on later, but you can see an example here of the wording for the movement theme. The next slide. So what's in the briefing? So as mentioned before, it aims to introduce public health to the planning system and land use planners to the public health system. At the beginning of the briefing, you'll find a navigation page, and this can help you determine which bits of the briefing will be most important to you, depending on what you're wanting to learn more about. So for those wanting to learn more about planning, it sets out the planning policy context, the difference between development management and development planning, who the key organisations are, how you can help shape the local development plan, how you can engage in the local development plan process, the links that planning has in with community planning, and how to influence the process of determining planning applications. And it also touches on health evidence that can help inform the planning process. For those of you that are looking to learn more about public health, it sets out the public health system and the public health responsibilities, and also shows where their key opportunities lie to foster links and develop alignment within the planning process. The next slide, thank you. So the briefing sets out a number of opportunities for better collaboration. So this includes engagement on the direction of the forthcoming national planning framework. So the recently published position statement states that NPF4 will be redesigned to support the population's health and wellbeing and address the long-standing health inequalities. So this provides an opportunity for a whole systems approach to share knowledge and build links through starting conversations and working collaboratively. It also highlights the opportunity of embedding the place and wellbeing outcomes, which we've just touched on, and also defining explicit links between planning and public health, as there's a current lack of this in many areas, and this can also be supported by the implementation of place and wellbeing outcomes. It also highlights the opportunity of combined skills development and mutual support, so there'll be opportunities for potential opportunities for on-the-job interaction, and this could help forge closer links. Also opportunities for stronger cross-working on measurements and performance of public health and planning. And there's also an opportunity as we recover from the COVID-19 pandemic to build back better and work closely with our communities to learn how their relationship with place has changed. So the briefing sets out the practical steps we can take to achieve this, and at the end, in the last section of the briefing paper, you'll see a table which sets this out, and it highlights, for example, things like nominating a point of contact within your team. And the next slide, thanks. So lastly, the briefing also sets out 4 key messages. So the first of these is stronger together for improved collaboration. So there are many benefits to sharing expertise, especially when undertaking evidence and needs assessments of local populations and places. The next one looks at shared evidence leading to shared policy outcomes. So with the development of shared evidence comes a shared understanding of local place-based priorities and long-term development aspirations. And this links in with shared policy actions leading to shared outcomes. So public health practitioners can assist land use planners in reviewing the long-term implications of planning decisions in meeting place and wellbeing outcomes. And lastly, building crucial relationships and exchanging knowledge. So this means planning and public health can work together to share good practice and realise opportunities to create places that can promote good health. And the final slide. So this is our contact details if you'd like to get in touch about any of the work we're doing or any questions you may have on the briefing.
That's great. Thank you. Thank you very much. Thank you very much for the introduction, Trevor, and thank you very much indeed for asking me along to give my perspective today. So I'm going to say a little bit about some of my experiences working jointly with planning colleagues. But first of all, I'm going to say a little bit about my background and so the lens that I see the world by. As Trevor mentioned earlier, I lead the Scottish Health and Inequalities Impact Assessment Network, and I'll say a little bit more about health impact assessment in particular. But first of all, to share the perspective that I'm speaking from, I work in public health. I'm very passionate about public health and in particular about health inequalities and what we call social determinants of health and how we can influence those. Social determinants of health are the social, economic and physical environments that collectively have a far greater impact on people's health than healthcare and even health-related behaviour. I've been working on developing approaches to health impact assessment in Scotland and internationally for about 20 years now, partly because I see health impact assessment as a practical way to engage with all of those different social determinants in practice. I was a consultant in public health in Lothian for 17 years, and among other things, I worked with our 4 Lothian local authorities on health impact assessments of spatial planning policy and plans. And I'll go on and say a little bit more about some of my work in West Lothian in particular. I'm not in a territorial board anymore, but obviously I still lead the Scottish Health and Inequalities Impact Assessment Network, and the slide shows our website and some of our resources. And I'm also involved in other work with Public Health Scotland on planning and health, including the Spatial Planning, Health and Wellbeing Collaborative Group that has already been mentioned. So one of the issues in trying to think about planning and health is that, as we've already heard, the links are multidimensional. There are many different ways that planning policy or spatial plans can affect health. It's not just about active travel, it's not just about green space, it's not just about local services or quality of housing, it's about all of those things and more. And also, different people have different needs and are affected in different ways. So it's important to consider each of these. And this means that if we're trying to understand how a plan or policy might affect health, we need some form of scoping to identify which populations are likely to be most affected and which of these outcomes are most relevant for that particular plan or policy. And I think the place and wellbeing outcomes that Susan mentioned can help provide a framework to do that systematically, and I'll say a bit more about that in a minute. So I've already mentioned health impact assessment, which I think can be a very useful way to understand the links in practice. It's systematic, so it includes a scoping process to pick out relevant populations and relevant areas of health impact. It uses different forms of evidence meaningfully to provide an assessment of those impacts. And it can be a way to help involve people and can be built into other consultation processes. It should be applied flexibly and should be proportionate. A health impact assessment is as long as a piece of string and can form part of an environmental assessment or another process if that's appropriate. And it can be used at all levels of policy and of individual planning applications. But fundamentally, I think it's about partnership. It really needs to be a partnership between public health and planning. There's absolutely no point me as a public health person swooping in and trying to do a health impact assessment of a planning policy or proposal in isolation of my planning colleagues. I need to work with them to understand the proposal and the context and what is feasible. So I'm going to give 3 different examples of the kinds of work that I've been involved in. So firstly, and the first one was a health impact assessment that I led on a specific planning application. And normally I would think health impact assessments of planning applications would be the responsibility of the applicant. But in this case, NHS Lothian was the applicant as it was a former hospital site and I worked for NHS Lothian at the time. The assessment involved a scoping workshop with the local community council. We collated a lot of relevant routine data to form a community profile. We carried out interviews with key informants, and we also used research literature to map out the impacts and make recommendations. And on this slide, I've listed the areas of impact that we identified, really just to show how broad the relevant health issues can be arising from one single application. And we made recommendations relating to each of these within our assessment. So as a public health consultant, this was in many ways a fairly standard health impact assessment using kinds of evidence that we're familiar with working in public health. The second example that I'm going to give is joint work with West Lothian Council Planning Department that led to revised planning guidance that requires health impact assessment of major applications. West Lothian already had experience of health impact assessment and previously had supplementary planning guidance that was not very often applied that had also required health impact assessment. So from around about 2015, I started working closely with the council and I based myself in council headquarters a couple of days a week. And one of the things I wanted to work on was what was the best way to ensure that health was considered in planning processes. So I had a series of meetings with colleagues, I held some workshops, and the Bangor health impact assessment that I just mentioned was around about the same time, and that was in West Lothian. So it served as an exemplar. I also led a scoping exercise with the Health Partnership on the LDP, which was in draft at that time. I had actually wondered if there might be another preferred approach rather than health impact assessment, but the planners that I worked with really felt that health impact assessment would work best with the whole process for planning applications. And so we worked jointly on revised planning guidance that included an agreement that NHS Lothian Public Health Department would scrutinise the health impact assessment reports that came in. West Lothian Council won a Scottish Award for Quality in Planning for the planning guidance, which was a real honour, I think, for the whole team. And personally, through all of this work, I learned a lot about planning and about the value of working so closely with planning colleagues, and I'm really grateful to have had that opportunity. The third example shows how we've used the place and wellbeing outcomes to review likely impacts on health of planning policy at different levels. So far, we've held 3 pilot workshops with public health and other stakeholders to go through systematically potential impacts on different population groups, on the place and wellbeing outcomes, and also on the national outcomes. And in effect, these have been just like health impact scoping workshops. And in each of these, we've made recommendations based on the discussion. The reports are all available on the Improvement Service website, and there's a formal evaluation that's currently underway, so I can't tell you what other people have thought of it, but I can give you my personal experience of this, which is that this fairly rapid workshop format did enable different perspectives to be heard and was systematic but also very quick way to identify relevant health issues and make relevant recommendations. So I just want to finish with a few reflections. I think the key to all of this is partnership work. In public health and planning, we share a common interest in and a commitment to the well-being of the population. So we've obviously got a lot in common. I know a lot about public health, but of course much less about planning. So I can bring some public health ideas, approaches, data and evidence in a way that I think can be useful, but it needs to fit within a planning context and planning processes. You'll have seen that I'm a fan of health impact assessment because I think the health impact assessment and process and tools are a practical way to ensure different populations and health issues are considered. But elements of it can be used very flexibly in order to do that. Okay.
Everybody, over the next couple of minutes, I'm just going to give you a couple of examples of collaborative working between Moray Council and the NHS Grampian in terms of planning, public health and inequalities. We've been working with the NHS Grampian mainly around developed obligations for a number of years, and that was probably our in terms of starting to make that relationship. I think it's really important that people recognise, and I've been very lucky in my role that my senior management have recognised the role that planning has in terms of prevention agenda, and that the implications for when we don't get planning right, the implications for a community in terms of the built and natural environment. And previous speakers were talking about the value of green space and access to green space, but the example on the left really was just a quick example to show when planning doesn't go right, a bit of a disaster that we have in a high density housing development in Elgin, and what should be and what was planned to be an amazing village, green, multi-use, multi-benefit, really helping in terms of public health, social integration and such like, is actually of more use to ducks and probably used for parking than anything else. So access to green space is really important, but actually the quality of that green space is the key for me. And to make sure that doesn't, that we've learned from these good examples, if you like, we've introduced much stronger policies into our local development plan, and those policies were developed with NHS Grampian colleagues. We now have a primary policy on placemaking, so the importance of place planning, and that includes detailed criteria on health and well-being. And as I say, NHS colleagues were closely involved in developing that policy framework. And to support the policy, the colourful wheel, another colourful wheel, you've seen a couple today, which is really good. We use a quality audit process, and this, similar to the West Lothian work, this won an award as well. And it's a tool that we use to implement policy. We look at residential developments and we assess them as a multidisciplinary team against these 9 criteria. And you can see on the right hand side, one of them is healthier, safer environments. The planning applications are assessed against these criteria, scored red or green. I'm not sure why one's grey there. And feedback goes back to the developer. To be perfectly honest, in terms of most volume house builders, it goes back as 9 reds. That's quite a sad state of affairs. I think there's a message there about the house builders have quite a different agenda, probably understandably to a degree, but that needs to change. So that's an audience we need to be speaking to as well. So we have a long, fairly protracted process that then follows to try and bring those applications up to where we want them to be in terms of policy compliance. Just another example of collaborative working we've been developing over the last couple of years, Elgin City Centre Master Plan, and NHS Grampian colleagues were closely involved in that work, a series of workshops and then sort of policies, projects coming out of them. And you can see that health is embedded within the vision on the left. Health is very much reflected in the core objectives, but the works are easy. It's actually the delivery of the projects is much more challenging. And we have a series of projects coming out to deliver the health and well-being aspirations. They're mainly around some of them touched on by Margaret, around active travel connections, greening, connecting areas of inequality. We have areas of inequality to the north and south of the centre, so we want to look at new connections to them, and addressing some of the day-to-day barriers that people face in terms of movement, seating, toilets, access to nature, some very basic sort of functions and service requirements. And to help us actually implement and deliver some of these projects, we're very lucky as an authority to have developed really great contact with an organisation called Parent Table and a local autism support group. I can just talk about Parent Table for a moment. That's an organisation of parents of children with physical or mental challenges who are now consulted in all our master plans and heavily involved in the Elgin work. And meeting groups it's just so eye-opening, and you know, it really does bring about change in the way you think. Basic things like in terms of Elgin, where we recognise there's no accessible toilets within the park, that there's a 30-degree incline ramp leading to a bridge which connects the park to the centre. But it's great having picnic benches with wheelchair access, but actually there's no access across the grass to get them. Actually, slightly cringy type issues getting highlighted that act as barriers to involving people and people being able to join in and be a sort of inclusive society. So we're learning a lot, we're meeting new groups, and it's certainly sort of refreshing in terms of a planner to trying to address some of these issues. We're now working on sort of co-design of the Cooper Park and other projects within the centre with Cairn Table and other organisations, which has been really good. And the third and final example I was going to touch on of collaborative working is within the Moray Growth Deal. It's a sort of £100 million city growth deal project. We have eight projects, and one of them is led by myself. It's a housing project, and it aims to deliver the aspirations that we have, policy aspirations we have for creating an exemplar of health and well-being, and also integrating the digital healthcare, which is again sort of a new field to me, into the housing and also into the wider place. We're trying to reflect some of the thinking in these two research documents. Mobility Mood Place, which was really looking at intergenerational living for age-friendly places, but actually much of it is applicable to all age groups and all environments. And Neighbourhoods of the Future, which for those of us who are slightly older and remember tomorrow's world, you'll love that. I'd highly recommend both these reports for having a read. The NHS Grampian and Digital Health Institute are represented in the project board and have provided us fantastic data support and project development to help move these projects forward. So I think that's a really interesting one. It's a £7.5 million project, and we hope that that'll develop a really exemplar for us. And my final thoughts are, I think that as the document sets out, a really great piece of work. I think so many opportunities for collaborative working around that prevention agenda, how we develop policies together, how we develop master planning, how we can look at projects with city deals and such like, and other projects that are coming forward. Building all the work that we do in terms of evidence-based for developed obligations. We've secured millions of pounds for healthcare infrastructure, pharmacies, health centres, and dentists. And final thought from me was that one of the best, well, actually, I'd say probably, sorry, Trevor, I shouldn't say this yet, the best CPD event I've ever attended before today was hosted by NHS Grampian, and they invited Moray Council staff across about 5 different services, from social work, was it environmental health, community support unit, planning, to actually go along and speak about what we do to NHS Grampian staff. There's about 150 people attended. It was absolutely brilliant, and most of the links that I've developed that day are actually now represented on various projects that we're implementing. So if you take nothing else from my couple of minutes of warbling, why not develop something within your own area, some sort of CPD event, bringing planners and healthcare practitioners together. Thank you very much.